always technical issues with lives, but that's the fun of it.
Exactly.
Okay, so I was just running through what we're going to discuss today. We're going to find out about everything to do with Get Harley, who are Get Harley and why would I partner with them. We're going to go through skincare consultations, all the differences between medical grade skincare and things like high street skincare and what the benefits are to you. And why would I sort of join or partner with somebody like Get Harley? What are the benefits for my clients? So if we can start with, who are Get Harley?
Amazing. Yeah, I'd be kind of share with your followers who we are. So essentially we're a teledermatology platform that enables practitioners and clinicians and doctors around the UK and beyond to recommend completely bespoke skincare plans to their patients. The reason that we're a little bit different and why we offer something pretty unique to the public and yourselves is you guys don't have to stick to one brand. So you now have a really wide range of medical grade skincare brands that you're trained in, that you're really passionate about. And it means that you can pick and choose different products from the brands that you love and that you kind of use yourself so that you can give really targeted solutions to your patients. We then actually manage all the logistics. So you kind of keep more space in your clinic so your patients can have a nice tranquil experience because we keep the stock for you. We then kind of send out boxes, really nice personalized boxes with patients' names on, and then we deal with replenishments as well so that people never run out of their favorite products.
That's amazing, and I think that's really important for me as a clinician to focus on, because I think now I found out that I've been sort of looking at really good medical grade skincare for a while now. You do find that one particular brand doesn't suit all skins, and it's good to have a little bit of one brand, a little bit of another brand, and it's amazing to have that personal connection and consultation with your skincare practitioner, and then have the ongoing support of never ever running out of your products and always having good medical grade products at hand. Because I think with any good skincare range, consistency is key. You need to keep moving with your skin changes and have regular assessments in clinic, because as you introduce more and more skincare and your skin improves from the condition that it was, your skincare routine will change. So it's good to have that really good connection between your clinician and that relationship with the with Get Harley, so that we can always keep the patients up to date with their skincare. Because your skin doesn't always stay the same. It changes with age and with hormones and different stages of the aging process. So it's really good to have that connection, I think.
Exactly, and that's why, because just to sort of let your followers know, once you actually receive your skincare plan sort of from Amanda through the Get Harley link, you can then actually interact with that chat. So if you are kind of having a really bad breakout and emergency help from Amanda, rather than you actually having to book in for a whole appointment to see her, you can actually just tell us via the chat and we touch base with Amanda, and then she can pass on information. Of course, if it kind of goes beyond that and it needs sort of medical assistance, then you can of course book in. But it's an amazing interactive tool for the patients working on their skin, if something maybe isn't working as well. So yeah, super interactive, which is amazing, because I know from personal experience you can buy a whole range of products and then they don't work, and then you're stuck and you've invested the money and they've not worked. So this is why this works really, really well, because you can actually check in with your patient and we kind of prompt you to do that, which is amazing.
Yeah, so what I'd like to do is take my clients step by step through the process of what will actually happen. So when they come to me for a skincare consultation, I love to have a look at their skin. So it's really important that you come to me barefaced, so without any makeup on. Then we can talk about how you feel about your skin when you wake up in the morning. Is it dry? Is it oily? Is it are there patches? Is there redness? What you find the biggest problem with your skin? And then I can talk to you about different products you have used in the past. We go through a full medical consultation. I talk to you about anything that you're allergic to, anything that you've used and hasn't worked or think you might like to use, and any sort of apprehensive feelings you have about medical grade skincare.
Just sorry to interrupt. So could you mind just explaining the difference between medical grade and maybe what people would find kind of on the high street and what's more readily available? What's so great about medical grade? Obviously we know, but for the followers.
Absolutely. So I think my clients hear me harping on about medical grade skincare all the time. So medical grade skincare it packs a punch. It is specifically targeted to your skincare type and your specific skin problem, because you've had a consultation, you've got the guidance, you've got the follow-up from your practitioner, and it's got specific targeted ingredients in it that can provide a therapeutic response for your skin type. So rather than having some ingredients in the product that are great for your skin and some are not so great, or some that are not sort of up to a good amount that will provide that result on your skin, some just have a sort of fairy dust sprinkling of the product in there to say that they've got, say, hyaluronic acid. Results, whereas medical grade skincare will be at a set cost and you'll know that the results are going to follow. So it's really, really important to have that skincare consultation and be guided to alerting the practitioner to what your actual concerns are, and then the practitioner be able to advise you on the specific ingredients to resolve your skincare problem.
Yeah. People can be a bit wary of the investment of medical grade skincare because they're probably used to trying different products, not seeing results, and then thinking, well, why would I want to, spend my hard-earned money on products that are really just great marketing and aren't potent in their formulas. So I think sometimes it's quite difficult to convey just how potent and powerful medical grade is and why it is then more of an investment. But once they start using the products and kind of seeing the results, it kind of makes it all worth it.
Yeah, well, I think you said something to me once, which was really, really, I remember it. And it was like, if somebody comes into the clinic, even if they're coming once a month, every month for 12 months, I can only look after their skin, provide a laser treatment, provide a peel, look after their skin and assess it 12 times a year. So that's 12 days out of 365 days. I'm handing your skin back to you so that you can look after your skin. So you're all going to do the majority of the work at home. I'm just going to put the icing on the cake when you come into clinic.
Exactly. Yeah, we always use the dentist analogy. You go to your dentist after your teeth, but there's only kind of so much he can do there. In surgery, you have to go home and brush your teeth twice a day, every day, to maintain that teeth health. And it's no different with your skin. You really have to look after it at home. You have to have consistency if you want to keep up the amazing results that your practitioner will achieve through medical grade skincare. But yeah, you're completely right. I love that analogy.
It's also the same as going to the gym. You've got to exercise and you've got to be consistent. If you go to the gym once, you're never going to get that toned gym body that you want.
So, dive a little bit more into why people need to come makeup free to come and see you for that skin analysis, and maybe talk to me about the kind of skin scanner setup that you have in the clinic as well, because I know you have this very sort of holistic approach to looking at the skin, and I'd love to kind of know more about that.
Yeah, so what I like to do is bring people into the clinic and have a little chat to them about all their concerns, and then everyone knows I work in A&E as well, so people come in and they say, I think my arm's broken and can I have an x-ray? So then we put them under the x-ray machine and their arm's broken, but we haven't actually achieved anything. We knew their arm was broken to begin with. But when you put somebody under a skin scanner, it's a lot different. It's a deeper look into the skin, and you can actually see all the, it's got a UV lamp on it. It will show us all the lipid layer. It'll show us the textural layers. It'll show us all the sun damage, which people often go, what's going on? Even if you can't externally see the sun damage on the outer layers, when you get under the skin scanner, you can't avoid it. So I've got this little skin scanner here, which I've sort of been on this morning. You sort of pop your head in here. It's really good. You pop your chin onto this part here, and we take photos. Okay, and then we can see all the textural layers of the skin, and I bring it up on my iPad and we can go through it. This is just one I popped of me this morning.
Mm-hmm.
So this is sort of the textural layers, and we can work through it. I'm not sure if you can see, it's a bit difficult, isn't it? It's reflecting. So one of the biggest, look at this. That's a dreadful photo, isn't it? That's all my sun damage underneath my skin. One of the biggest things of aging is the inflammatory process. So we really need to calm down all the inflammation in our skin. And this is one I took earlier, sort of in the year, so that I can see the improvements moving on. So I can put myself onto a skincare regime, and then in 12 months' time, I can put myself back under the skin scanner, and we can see the improvement and see anything that we need to sort of use moving forward. We can change the plan, and it gives us a lot of encouragement, so that we can really have a plan moving forward to improve our skin health.
And I think it helps because often as humans we need, you know, words are great and you can tell me about my skin, but actually seeing visuals really helps, and then you can break down exactly, okay, you have this concern, and so I know that this product is going to be the answer for that concern. So I suppose it fits in with the Get Harley plan quite nicely.
Yeah, I mean, there's a lot of different things that cause our skin sort of damage, and we can talk about all the things to sort of avoid. And you know, you need to be keeping your skin hydrated. It's all about what you eat, what you drink, how you exercise. Sleep is a major contributing factor to skin aging as well. So it's more of a holistic approach that we'll talk about during your consultation. So we'll not only talk about your problems, we'll pop you under the scanner, we'll talk about your overall health, and moving forward come up with a plan, and then it can be followed through by Get Harley, and the consistency will remain. So that's the amazing step forward we're taking in the next couple of months. I'm hoping that everybody's going to be contacted, everybody will get on board, and we can really get some consistent skincare happening into 2023.
Exactly, 100%. We can actually, you know, people can of course come to see you in clinic, but we can actually set you up little virtual consultation. So anyone that's watching today or that will kind of see this video going forward can actually book in for a quick 15-minute chat virtually about their skin, and then you can decide whether or not they kind of need to come into the clinic, or you can just kind of create a plan for them straight away, just because we want everyone to have amazing access to medical grade skincare.
That's amazing. Okay, I think we know who Get Harley is now.
Thanks for the chat.
And how we're going to use it moving forward. So I hope I know we'll make a great team working together and working with all my beautiful clients. I'm really excited about this. So I do hope you get on board and move that skincare range forward, move that skin health forward. And it's great partnering with you.
You too. Thank you so much, Amanda. Have a wonderful day.
See you later. Bye-bye.